I'm Dr. Sarah Dawson. I'm an internal medicine specialist here in Bend, Oregon, and I'm the owner of I'm Well Internal Medicine and Wellness.
My name is Joslyn Gibson. I am a physician assistant, and Sarah and I have been working with each other for the past 5 years in internal medicine.
I get asked often why I made the switch from sort of traditional medicine to what we're doing here at I'm Well. And we made that choice about 2 years ago, worked on this concept for about a year, and opened in August here in the Old Mill District of Bend, which has been really great. So I was pretty burned out at the time that I decided to make a change. I think after COVID, lots of providers and also patients clearly were just kind of unhappy with the status quo. It was really difficult to, be in front of patients who really needed me and only have a tiny amount of time or limited follow-up. And so I sat down one day and just thought, okay, if I could redesign healthcare from the ground up, what would that look like? If there were no barriers, how would that be? And so I was really focused on providing an amazing experience for our patients, one that was low stress with very little barrier to get in to see us. Even now I pick up the phone and patients are always like, what, you answered the phone? So our membership here is a small group of people that we're able to take excellent care of without any of those kind of headachy things that patients might experience out in the community. So one of the main areas that was lacking in my last internal medicine practice was really the ability to take stock of a person's entire health. For myself, for my family, my friends, when I'm talking to them about their health and we have unlimited time, we're talking about diet and exercise and how they're sleeping and how their social life is and if they have any spiritual connections. It is really medicine 3.0, and that's essentially taking stock now while we feel healthy of what our future health risks might be. Most people, unfortunately, we're all going to die one day, but most of us will die either from cancer or heart disease, dementia, or metabolic complications of diabetes. And those are all things that are fairly preventable and certainly treatable in the early stages of illness to improve a person's health span. So when we have a patient or patients come together to our office, one of the first things that we do is really take stock of what those risks are. And that might be based on advanced genetic screening that we do or family history, certainly lifestyle factors as well. And then we make an assessment of, okay, it looks like you have a very strong family history of heart disease. What can we do to assess where you are in that process now before you have symptoms, and then to prevent that process from being something that would shorten your life later? It's a really novel approach. It does take it takes time, but that's the beauty of this system, is that we have all the time that we need to really help patients and keep them healthy in the long run. We do a lot of assessments on diet, metabolism. Every one of our patients gets a metabolic screen that includes a body composition analysis. And that really helps me to understand metabolically, where are you? Are you somebody that has a lot of internal fat around your organs that's going to cause trouble? Are you somebody who maybe is thin but doesn't have enough muscle to stay healthy as you age? So we get all of the information and then have a plan with our patients to keep them healthy going forward. And then as things come up medically, we are able to treat them for that as well. So after we've gone through an in-body biometric scan for our patients, we get a sheet of information that's really helpful to go over, and that looks at not only how much body fat versus muscle you have, but also where you're storing your fat, and metabolically how active it is. So sometimes we see folks who have a lot of subcutaneous fat, which is not metabolically active, and that's fine, although they might have a goal of weight loss. And sometimes we see people who are pretty thin and they have a lot of internal fat, which is metabolically dangerous for their health. And that's what we're interested in here, is getting people to be their healthiest and lowering the risk of diabetes and cancer and dementia and things. So after we have this assessment, I'm able to sit down with patients and really come up with a plan. We guide patients with information telling them sort of exactly how to go about making certain changes, whether it's exactly what to eat or even how to exercise, specifically for weight loss, fat burning. There's various protocols that we use to help patients be successful. Other folks maybe were working on building muscle. The biometric scanner also notifies us of any imbalances in muscle distribution. A person might have a leg weakness that we're focusing on, so we're trying to build more muscle on that side. But nobody's ever left to kind of figure this stuff out on their own. We really have a step-by-step approach with lots of follow-up and communication between myself and our patients to ensure a successful outcome. If diet and lifestyle isn't enough to really jumpstart a person's success or for them to achieve success, we also do offer various medical weight loss options as well if it's medically appropriate for the patient. But all starts with a really good understanding of what's going on in a person's metabolism and body composition. One of the most important aspects of health is really emotional and mental wellness. Because it's so important, we've taken some steps here at I'm Well to prioritize helping our patients to become healthier in this area. We have an embedded therapist who is available to our members without any wait times, which is fantastic. And we also provide much intervention, including health coaching and cognitive behavioral therapy for sleep optimization. Getting sleep is about the most important thing you can do for your health. So we spend lots of time with our members on optimizing their sleep and have a chest of tools that we use to really get to the bottom of folks' sleep trouble, whether it's insomnia or just not sleeping enough hours in the day. The last thing that's so important for mental and emotional health is really comes down to mindfulness. I'd heard that word so many times and it was frustrating because it sounded good, but I didn't really know what it meant. So we've taken steps to incorporate a meditation practice in our office using the Somadome, which is the first technology-enabled meditation pod to help our members experience firsthand what a meditative state feels like and to have that coaching directly to get into a meditation practice and make it second nature. It's great for stress relief. We have patients who begin or end their visits in the Somadome. We've seen this benefit all sorts of things from blood pressure to sleep to just general anxiety. We've had elite athletes who are our members come and use the Somadome to meditate and manifest excellent results in their competitions too.